As a diplomate of the Upper Cervical program, I feel a tremendous weight now upon me. I have a tremendous responsibility to make sure that I give an even higher standard of care. You know, in upper cervical world, we do give a very specific adjustment. And with that, I also feel the responsibility to make sure that I start talking to students, that I start making them involved in what needs to be done to further the upper cervical world. Now, as a diplomate, now we actually have the knowledge to take care of patients that maybe have never been able to find any sort of help with traditional chiropractic care. We were able to take it to that next level. That next level is the precision care to really open up this area. It's just a tremendous responsibility to make sure that that the standard of care that we give patients is top-notch. And being a diplomate, that's what we put forth. That's now the responsibility that we have. Now, the conditions now that I'm seeing just being through this program, I'm actually attracting more patients with neurodegenerative diseases like MS. I've even had some Parkinson's cases in the past. And looking at, vertigo, migraines, really even post-concussion syndrome. Right now that's huge. Concussions are such a big part of now the talk around the neurological areas. And the only outcome they have in any of these conditions really is that it's only going to get worse. There's nothing that can be done for these people. And it's usually drugs and more drugs and more drugs. There really isn't any really good approach, any standard of care that is given to these patients, and they're usually left in the lurch. When they come to our office, not only do we have a standard of care for these types of conditions, but we also have the knowledge and even the pre and post studies now that we got to see during our during the diplomate program. But I'm able to see changes in my patients now that are coming in with these conditions, and I'm not necessarily treating the conditions. We don't treat MS. We don't treat post-concussive syndrome. What we do is we look to the cause of these problems. And now that I see these patients coming in and their symptoms being relieved, and they're being a part of their community, they actually can be a part of their life again. It's really, really rewarding.